There were 2 maternal deaths recorded at the weekend according to information released by the Georgetown Public Hospital Corporation. The first maternal death involved a 40-year-old woman from Region 6. That woman was initially receiving treatment at the New Amsterdam Hospital before she was transferred to the National Infectious Diseases Hospital at Liliendaal, Georgetown. The newsroom understands that that woman presented with several underlying conditions that complicated her treatment. She was also COVID positive. Eventually, she passed away and her child was not at a viable age for delivery. The second maternal death involved a 19-year-old woman who was expecting twins. She was initially receiving treatment at the Diamond Hospital on the east bank of Demerara. However, complications in her treatment saw her being sent to the Georgetown Public Hospital for further treatment. According to Minister of Health Dr. Frank Anthony, that woman had preeclampsia, which meant that she had high blood pressure that complicated her pregnancy. She passed away along with her twin. The Minister of Health, in his COVID-19 update on Monday, explained what happened, but he also noted that 2 separate investigations have been launched to understand what went wrong and if there were potential gaps or shortcomings in the delivery of healthcare to these 2 mothers. One investigation will be completed by the Georgetown Public Hospital itself. Another investigation, an independent investigation, will be completed by the Ministry of Health's Maternal Mortality Committee.
Any deaths that occur at the Georgetown Hospital would undergo a thorough internal review by the specialized staff of the hospital. And so that review has commenced for both cases. And while they're doing that, there's also going to be an external review that would be done by the Maternal Mortality Review Committee, which is an independent body away from the hospital. And so all the documentation relating to this case has been sent to that committee, and that committee would also do an independent review. The findings from both of these reviews would help us to see whether there was any gap in providing care, and if there were any, then we'll have to address those gaps.